Why are brain MRI scans so cold and uncomfortable? Imagine lying perfectly still inside a machine that feels more like a giant tube than a place of comfort. Brain MRI scans are incredibly useful for diagnosing issues like brain tumors, but many people wonder why they feel so cold and uneasy during the process. The main reason is the environment and how the scan works. The MRI room is kept at a low temperature to keep the powerful magnets and electronic components inside the machine from overheating. These magnets are essential for creating detailed images of the brain, but they generate a lot of heat. To prevent this, the room is cooled, which makes the overall environment quite chilly. When you lie down on the narrow, hard table, it can be uncomfortable, especially during longer scans that can take 30 minutes or more. The table is designed to be very stiff to keep you perfectly still, which is necessary for clear images. The confined space of the MRI bore can also cause feelings of claustrophobia or anxiety, adding to the discomfort. Many patients feel anxious about being in such a tight space, which can make the experience seem even more unpleasant. From a physiological point of view, the MRI uses radiofrequency energy to produce images of the brain. This energy causes very slight heating of body tissues, especially in fatty areas where there are fewer nerve endings to sense pain or heat. However, because the room is so cold and patients are often dressed in minimal clothing or hospital gowns, they tend to feel cold rather than warm. Sometimes, a cotton blanket is provided to help, but it doesn't fully eliminate the sensation of coldness. The heating effect from radiofrequency energy is carefully controlled and is usually very mild. It is unlikely to cause any harm or discomfort, but it can lead to localized warming under the skin. Still, most patients do not feel this directly. Instead, the overall sensation is of coldness, partly because of the cool environment and partly because of the need to stay still and limit movement during the scan. In the context of brain cancer diagnosis and treatment, MRI scans are invaluable because they produce high-resolution images without exposing patients to ionizing radiation. Despite the temporary discomfort, the benefits of MRI in detecting and monitoring brain tumors are significant. Medical staff are trained to help reduce discomfort by providing support, monitoring for any adverse effects, and making sure patients are as comfortable as possible. So, to sum up, brain MRI scans feel cold and uncomfortable mainly because the room is kept cool to protect the equipment, patients must lie still in a tight space, and the radiofrequency energy used can cause mild tissue heating. All these factors combine to create a sensation of coldness and unease during the procedure. Remember, if you ever need an MRI, discussing any concerns with your healthcare provider can help you prepare and feel more at ease.